Rusty Botchalk here. Just wanted to take this opportunity to share with my practice and my patients basically where COVID is right now and where I think it's headed, and also trying to encourage patients to join the effort to end this pandemic. Um, so, 17 months ago, when COVID initially hit, I was extremely discouraged just about how many of my patients became extremely sick. We have lost 6 patients in the last 17 months who have died of COVID, including patients as young as their 40s without really any other medical condition. Hundreds of patients have become sick, a lot of them with long-term symptoms, and yet a lot of people didn't become that sick with COVID. So it's extremely variable, hard to predict. And I've got to admit, as a doctor taking care of this, it was extremely discouraging, especially at the beginning. And the one thing that I hoped and prayed for above everything else was that, one, we have a way to hopefully help patients when they're sick, and two, that we could get a vaccine that was at least 50 to 60% effective. Unfortunately, we have not come up with very many ways to help patients when they are sick. But there was a huge answered prayer when the vaccine came out, showing that really almost 90% of people, if not greater, who got vaccinated were protected from the disease. And the way I looked at it, that was truly a godsend. When we look at vaccines that we think are really good, things like measles, mumps, rubella, and chickenpox vaccines, and some of those, they may run at best an 80% success. And yet suddenly we had this horrible worldwide pandemic that was killing people, and hundreds of thousands of Americans that have died from. And yet we managed in a very short period of time to come up with a vaccine that was well over 90% effective against this deadly disease. And so I really thought it was a godsend. And was ecstatic for that. And suddenly when the vaccine started getting distributed, especially in January of 2021 on, we started seeing our cases massively decrease and death rate massively decrease and hospitalizations coming down. And I was extremely encouraged. So right now, a lot of people are asking me questions about should they get vaccinated, because a lot of people haven't. If we look at the vaccination rate in our county, it's probably about 50%, which is about the equivalent of the United States vaccine rate, but that's still extremely low. And so a lot of people are very nervous. They're very scared. This is a new technology, some people think, and it's a new vaccine that has not been vetted like some of the other vaccines, or at least people think that. But to be honest with you, if you really look at all of the studies and all of the research that was done and the numerous months of these scientists giving the vaccine and then following the patients for numerous months, there was actually a lot of patients that were tested for this vaccination, and it proved to be extremely safe. If we look at some of the other vaccines that take years before they come to market, to be honest with you, a lot of it's red tape and them jumping through a lot of hoops to get officially approved to be able to even test them, and then to get the testing ways and methods set up. Anyway, it's just a lot of red tape. And because we realized that so many people were dying from this, the United States CDC and some of these regulatory agencies basically said, let's just get people vaccinated, and let's speed along the red tape process to start doing the studies. And the studies were unbelievably encouraging, how well these vaccines did and how safe they were. But I've got to admit, it's a risk versus benefit thing. And when you look at anything from taking Tylenol to getting a flu shot to getting vaccinated for COVID, you have to look at risk versus benefit. So if we look at this side, what if I don't get vaccinated for COVID? What's going to happen? The truth is 1 in 550 Americans died since COVID started of this disease. And so that's a lot. That's a huge risk. If I said there's a 1 in 500 chance you're going to die over the next year of a particular illness or anything, you would be appropriately extremely alarmed by that. And And so it is scary that COVID is still circulating and people are still dying from it. To be honest with you, the main reason why I'm putting this video out is COVID Delta variant is hitting hard in our community. I don't see it as much in the local media, but I'm seeing in my clinic over the last week, our numbers have just ramped up. If we look at what's hit in the United Kingdom, that also has about a 50% vaccination rate, those numbers are also massively spiking. So I'm scared that it's truly going to be another deadly spike coming before us. So I truly believe there's about a 1 in 500 chance of you dying from COVID over the next year if you've not been vaccinated. So then you start saying, okay, what's the risk if I do get vaccinated? There's a lot of misinformation out there in the media about that it's a very scary vaccine and that people are having a lot of problems with the vaccine. But the truth is, I'm not seeing it. We're giving the vaccine here. We've had obviously hundreds, if not thousands, of patients get vaccinated. And yeah, some people definitely get flu-like symptoms, especially after the second shot, if you get a Moderna shot or if you get the Pfizer shot. But other than flu-like symptoms for a few days, most people are not getting any other weird symptoms. There have been some cases of a blood clot issue that's probably more rare to get if you get vaccinated than if you didn't get vaccinated, because the chance of you getting blood clots while having COVID is a lot higher risk. And so I've been really pleasantly surprised how few people are getting side effects from this vaccine. And so let's say that there are a handful of people who actually died because of the vaccine, which there's a handful of people who die from Tylenol or Advil every year, and that's just a reality. But of the 300 million vaccine doses, let's say hypothetically that a handful of people have definitely died from the vaccine, which to be honest with you, we don't even know for sure. But even if that's true, there's probably a 1 in a 50 million chance of you dying from getting vaccinated. Well, if you compare that to 1 in 500 chance of dying from not getting vaccinated and from just having COVID, clearly getting vaccinated is so much safer than not getting vaccinated right now. And so people say, well, what about side effects? Again, the side effect rate has been unbelievably low. And I think patients are really pleasantly surprised that they aren't getting that sick, they don't feel that bad, and that the chance of you getting a serious side effect from the COVID vaccine is extremely low. But the truth is, I've had tons of patients who got COVID who now months later, even some over a year later, are feeling horrible still from COVID. They can't breathe, they're unbelievably fatigued, they're having a lot of side effects from getting the actual illness. So in no way do I think that it is safer not to get the vaccine, even from a lot of the potential side effects. Some people have asked about fertility and are worried about fertility, but study after study shows that plenty of women are still getting pregnant after getting vaccinated, after getting COVID, the illness as well. And so some of the faulty warnings that people initially came up with, saying that, hey, this is a way to prevent the United States from getting fertile or being able to have babies anymore, have just shown that it's just not true, that it's just made up things, I think, just to scare people or to potentially sell a movie that actually had the exact same plot. So don't believe there's fertility issues at all with that. So the next question is, should kids get vaccinated? I think so. Right now, the Pfizer vaccine is approved from age 12 and above. I think the Moderna will officially get FDA recommended from also age 12 and above. And even though kids age 12 and above are not anywhere near typically as sick as adults, and especially older adults with COVID, the truth is I think kids will spread this, especially it will spread the Delta variant, and there's just no reason for them to get sick with it. My wife and I recently attended our niece's graduation, and one of the most heartbreaking things I've seen this year to do with COVID was the fact that about 2 people in line after my niece graduated was a family, a mom and a dad, accepting an honorary degree for their child who died of COVID this last year. And I assume it was just a 21 or 22-year-old who ended up passing away from COVID, something that could be totally prevented with a vaccine. So I definitely recommend kids get vaccinated as well. I'm vaccinating my kids for it. The other thing that I think that people need to realize is that I think there's a social responsibility to getting vaccinated. For any individual person, I definitely think it's safer for that person to take care of themselves by getting vaccinated. I think one of the most selfish things you could possibly do right now is to get vaccinated, because it's going to keep you from getting illness, keep your loved ones from getting illness from you. And I think the side effects are extremely low and the risk is extremely low. But to be honest with you, I think one of the most selfless things you can do to serve others is to get vaccinated if you haven't already, because that will serve others. Because even if you're saying, hey, the risk that I'm going to get very sick from COVID is very slim, but there's a risk that you could be passing it on to someone who is immunocompromised. So the vaccine didn't work for them, or they have not had a chance to get the vaccine. So serve other people in your community and your families by getting vaccinated. I think it's the best way you can serve others and serve yourself, to be honest with you. So again, definitely highly encourage everybody to get vaccinated. I think it's a smart thing to do. I think it's a social responsible thing to do. I think it's the most loving thing to do for you and for others. I'm scared of the Delta variant right now, just because of what I've seen in the last week or two. It is scaring me. And I think if we real quickly start getting people who are not vaccinated, I think we could probably outpace this Delta variant and start ending this pandemic completely right now. So please don't get lazy. Don't think, I don't need to wear masks anymore. If you're not vaccinated, please wear a mask for your own good. Please get vaccinated for your own good and also for the good of others. If you have questions, please come up here. If you want to get vaccinated, call our clinic. We have the Moderna vaccine available that we're bunching on Tuesdays and Thursday afternoons, or call any pharmacy in town. There's tons of vaccine out there. You can get vaccinated within 24 hours of probably receiving this email, and I would encourage you highly to do that. So let's work together. Let's end this pandemic and make this stop. If you have any questions, please contact our office. Give us a call. Or if you just have any questions you want one-on-one, make an appointment. We can discuss it. All right. Y'all be careful out there. Please get vaccinated.